The consequences of losing someone to ABI can be a tough situation to process, especially if you are caring for someone who is currently grieving their own loss due to an ABI, as well as dealing with your own grievances for the loss of a loved one to acquired brain injury, or ABI. It can feel almost as if you had lost someone from the cause of death, as the person you once knew is now gone. However, there are some ways for someone with ABI, as well as someone mourning the loss of ABI, can work together to overcome grief. What is ABI? First, we need to understand what an acquired brain injury, or ABI, is. ABI is any brain damage that occurs to an individual after birth. When talking about ABI, it is important to know that there are two types of ABI. One is traumatic brain injury, or TBI, which is the result of a traumatic external event where an injury to the brain is sustained. Examples of TBI can include head trauma from a vehicle accident, hitting your head after falling down the stairs, head trauma from a sports accident, as well as impact to the head from a violent encounter. The other form of ABI is non-traumatic brain injury, or non-TBI, which is the result of an internal disease process that also leads to damaged brain tissue. There are many examples of non-TBI. Some of these include strokes, lack of oxygen to the brain tumors, aneurysms, and infections. Regardless of the type of ABI, both can impact individuals with different outcomes. Outcomes of ABI. After the initial brain injury, there are many outcomes and symptoms that impact individuals in very severe ways, leading to long-term effects. Some of these effects can include cognitive issues like thinking, learning, remembering, and decision-making, emotional ability, also known as mood swings, and stigma, stress, and depression. Dealing with grief. Not only can these long-term effects lead to negative emotions following the individual diagnosed with ABI, but it can also lead to negative emotions such as grief for the people involved in the individual's life, such as parents and partners. However, there are some concepts and strategies that can be of help to families dealing with the grief of losing someone to ABI. Strategies. There are many strategies that can be implemented for grief from ABI. In this video, I will be explaining some of the methods that can be used for families or friends dealing with someone going through grief with ABI. The first strategy is adapt to emotional behaviors. The first strategy as a supportive family member is to adapt to the various behaviors which can come from very aggressive to rapid mood swings, such as emotional lability and anxiety. Strategies for adapting to emotional lability can involve becoming aware of triggers for aggressive behaviors, ignoring problem behaviors in the hopes of eliminating problem behaviors, changing topics or tasks, redirecting actions when getting upset, and avoiding stressful situations and planning activities within a person's ability. Strategies for adapting to anxiety can involve avoiding environments that may stress someone out, reducing environmental demands like making someone who gets stressed in the kitchen clean the dishes, as well as adding structured activities and providing the individual with calm language, as well as helping reassure the person. The second strategy / concept that individuals should learn about is to learn about Kubler-Ross's 5 stages of grief. The 5 stages of grief is a model that was used for understanding the psychological reaction to imminent death. However, grief could be applied to someone with ABI as well. Someone with ABI could be considered as a loss, since that person may no longer be the same anymore. Learning about Kubler-Ross's 5 stages of grief can provide awareness and preparations for peers and families on what they may have to go through when helping someone with an ABI, as well as help them understand what the individual diagnosed may be going through. The first stage is denial, which is a defense mechanism to protect an individual's self from the upsetting reality of themselves considering that they are no longer the same person anymore in the context of having an ABI. This typically occurs after the initial shock of the diagnosis and can also include peers denying a loved one's diagnosis. However, it isn't necessary for caregivers to repeatedly educate individuals about the truth of their diagnosis, unless they truly don't understand the situation they are in. The second stage is anger. Once the reality of the situation sinks in, the individual diagnosed and sometimes the people surrounding them may experience anger towards many factors, even when sometimes said factors had nothing to do with it. Examples of this anger towards themselves, medical clinicians that diagnose them, other family members, and spiritual powers. It is important and valid criticism towards them isn't disregarded. The third stage is bargaining. This stage typically manifests as individuals attempting to gain some control over their diagnosis. Examples of this are individuals resorting to religion to negotiate with a higher power to change the outcome of the situation, potentially accepting them from peers and caregivers, or committing to treatment recommendations. It is important not to mislead people about your ability to fulfill their bargaining request. The fourth stage is depression. This stage results in unsurprising symptoms such as sadness and fatigue. This could potentially be an unconscious effort to protect oneself from the pain emotionally. Caregivers should try to restore compassion that individuals with ABI may want. The final stage is acceptance. This includes recognizing the reality of the situation while no longer protesting the fact. Support is an important factor in this stage, as the individual has come to terms with the situation, and this is a difficult thing to process. This leads into the next strategy, support. One of the most important things that someone must provide to someone during the grievance of an ABI. Peers should support an individual and not detach from one's during feelings of depression. Especially, quote, parents should be encouraged to refrain from social detachment and isolation and assume active coping in creating supportive systems. Yahin et al. 2021, page 123. Interactions with the ABI survivor and collaborating with them in activities and goals can help support their mental health. Support can also include tending to survivors' needs due to any potential impaired motor functions. It may not be easy to do on your own, so looking towards peer support programs could also be a huge help. Another strategy is behavior activation, or BA. This is a resource that families can ask for when visiting a professional to help with ABI depression. This process is considered a therapeutic treatment and a cognitive approach to dealing with depression after an injury. Behavioral activation can occur in two primary ways. One is increasing the amount of positive reinforcement a person experiences, which might end negative behavior patterns that cause depression to worsen. The other is replacing negative avoidant behaviors with new rewarding behaviors to increase positive reinforcement and reduce negative reinforcement. To implement this intervention, it is important to be aware that the individual is unlikely motivated to participate in any activity. However, helping the client recognize that their avoidant behavior is causing their depression to worsen can help. This can include pinpointing negative behaviors, patterns, and collaborating to know what had changed, i.e. drawing a quick diagram to analyze process, as well as finding replacement positive behaviors, which should be easy and rewarding. To plan this intervention, creating a list of positive, rewarding behaviors and selecting which ones to use in terms of ease is a thing that can help people consider what behaviors should be used and reinforced. Choosing a peer who they're comfortable talking about the situation with can also help them ease into the intervention plan. It is important to check in on an individual, as this will be a long-term process. Cognitive treatments is the last strategy we will talk about. Cognitive treatments such as cognitive behavioral therapy, or CBT, is another resource that families should investigate. This can include cognitive restructuring, having people avoid negative thoughts about themselves, making the survivor of ABI build upon simple tasks that they can perform, and helping them learn skills such as communication and emotional regulation. Cognitive treatments can also connect to behavioral activation. Conclusion. In the end of the day, despite the individual losing parts of themselves after an ABI, it is important for them and the family to consider that it isn't the end and that there are many opportunities to help support them. All of these strategies presented are all potential steps to lead up to an ABI survivor rebuilding themselves and learning independence.